A reorganisation of hospital services in Worcestershire was approved today. It means babies will not be born at the Alexandra Hospital in Redditch, and emergency surgery will only take place in Worcester.
Accident and emergency services will remain at both hospitals, but only adults will be treated in Redditch. The Health Secretary has previously said Worcestershire is the trust he's most concerned about, and all three hospitals were rated as inadequate in June. Callum Watkinson reports.
For 8 years, a twin, Aidan Cartilage, is getting used to life as one of a kind. His brother Callum died of a heart attack in March. He was taken to Worcester for treatment following the temporary closure of some children's services in Redditch. His father didn't think much of the news today that A&E there will now only treat adults.
I'm disgusted. Not everybody lives in that area. What about other people like us that have to drive to Worcester? It's disgusting.
Whilst an inquest is yet to determine whether that ambulance journey was a factor in Callum's death, this change was one of several signed off by health bosses today. Furthermore, there will be no emergency surgery and no more hospital births in Redditch.
No NHS cuts, no.
Former members of the Save the Alex group were at today's meeting, though they wound up their campaign in January, saying there was nothing left to save.
What the CCGs and Worcestershire Health Trust have to do now is prove to me and the wider public that they have it right, we have it wrong.
Well, from 2012, this is always about cutting the services at the Alex, and today that's just been the rubber stamp, hasn't it? It's just been approved.
Expectant mothers opting to give birth in hospital will only be able to do so in Worcester now, half an hour from Redditch and Bromsgrove. As I pointed out to the Trust's chief executive, that's a long way if you don't have a car.
There's no getting around the fact that there are women in Redditch and Bromsgrove who are going to be having their children in hospital in Worcester who don't have cars, and the only way they're going to be able to get to hospital is on a bus, and that's a very unpleasant situation for a woman in labour.
The fact that women in the county have predominantly been having babies at the Worcester site has now been the case for a couple of years. Mums-to-be are very organised and creative people, and there's usually a network of support around people to assist them.
In order to make this plan work, the Trust will need almost £30 million of extra money for improvements to the Worcestershire Royal. They will ask the Department of Health for that over the summer and plan to finish the work by 2020. Callum Watkinson, ITV News, Bromsgrove.
Well, we're joined now by Joe Ringshaw from Health Watch Worcestershire, and that's a group which represents patients. Joe Ringshaw, welcome. Are you happy with these new arrangements?
Happy is a strong word. I think that they have been dictated by clinical necessity. They have all been signed off by the West Midlands Clinical Senate, and the clinicians say that this is the only safe way to deliver services in Worcestershire.
But what's your take on this? Do you think it's really going to work?
I think it'll have to work. I think the things that people are most concerned about are the accessibility of services, and we've been assured by the CCGs that 95% of patients won't actually see any difference in their services, and it's up to us as Health Watch, as the monitor, as the watchdog for health and social services in the county, to make sure that they're held to that, and so we need to hear what people have to say.
But the sheer practicalities of this, I mean, it's a 40-minute journey between Redditch and Worcester on a good day. I mean, that's a long way, isn't it? A lot of time in an emergency.
I understand from the CCGs and from what they said at this meeting this morning that they have invested more in ambulance services, and there is some work being done around community services. But yes, I mean, it is a long way, but if you can't staff rotas because of national shortages of specialities, and this is the clinical safe model that West Midlands Clinical Senate has authorised, then we have to make it work.
Do you think it's going to address all those problems identified by the Health Secretary, who is very concerned about these three hospitals?
I I think so. I mean, some of the issues are about patients being in the wrong place, and if you have all planned care on one site and all emergency care on another, then it makes your patient flow much easier. It means that your planned operations aren't being blocked by emergency people coming in, and it means that your emergencies aren't being blocked by planned. So actually it makes a much clearer patient flow. So I understand, again, this is, what the clinicians have recommended, that this is the way forward.
Jo Ringshaw from Health Watch, thank you for joining us.
Thank you.